Welcome to the Breast Cancer Rehabilitation and Wellness Summit for 2020. Last year, we introduced the concept of vagus nerve stimulation with Emrys Goldsworthy, and I want to bring more information to you in this session. And so today we'll be talking with Melanie Weller. Melanie is a physical therapist and has really investigated the role of the vagus nerve, which she will explain what it does, but the role of the body and the vagus nerve. Welcome, Melanie.
Thank you so much, Denise. I'm so excited to do this.
So, Melanie, can you I'm just going to hand over to you. So you're going to take us through the journey of the information that you know about, the amazing information about the vagus nerve and the body.
Absolutely. I'll tell you as much as, well, I'm only going to really even just scratch the surface about what it does, but I will touch on some of the the most amazing things that I'm familiar with. So my name is Melanie Weller, and you can, I'm a physical therapist, like Denise said. I specialize in the mechanics and metaphysics of voice, body, and breath. And you can find me on social media at Embody Your Star. You can connect with me over LinkedIn. You can WhatsApp me, text me, email me. There's all of my contact information. I would love to hear from you, and please feel free to reach out with any questions. So as a physical therapist, I spend a lot of time working with alignment. And what I've discovered over the years is that I think most of us think too small about alignment. And so to me, there's this, I've developed this sort of holy trinity of alignment, or the three main aspects that I look at to really help people. And my background is in treating complicated chronic pain patients and others who have not found success within the medical system. So I come through that lens, for the people that, some people do very well in the traditional medical system. I have overwhelmingly seen the people that did not do so well. And so this has evolved as a result of kind of my own detective work and problem solving their cases over the years. And so the first part of alignment is just our structural alignment, which we're all really familiar with. That's what physical therapists do. We work with posture and movement. We all, whether we're still or whether we're moving, we have an alignment. We have a base of support, whatever's in contact with the ground or the whatever surface we're on. We have a way that we sequence movement. And we also have a trade-off between stability and mobility. So for example, if you're sitting in a chair and you're way at the back of the chair, it's a little bit harder, or sometimes a lot harder, to stand up than if you're right at the front edge sitting right at the front edge of the chair. But when you're towards the back, you have more stability, not as much mobility. When you're at the front, you have more mobility, not quite as much stability. And so we all make these choices consciously and subconsciously as we move through the day. The reason I believe that treating your vagus nerve like a pinched nerve or like it's gotten compressed, which I'm going to show you how to do today, helps so much with physical alignment is because your vagus nerve uses the same neurotransmitter that your muscles do. And so you get very beautiful neuromuscular shifts with it. The second pillar of how I look at alignment is electromagnetic alignment. And your vagus nerve, because it innervates your heart, and I'll talk more about that in a little bit, creates the electromagnetic field of our hearts and our bodies. And there's published research that shows that our electromagnetic fields synchronize with the electromagnetic field of the Earth. And that when solar weather and space weather disrupts the electromagnetic field of the Earth, that's measurable in our vagus nerves, that it shows up in our heart rate variability, which is the gold standard measurement for vagus nerve function. Tying back into the structural alignment as well, there are critical angles in the body that mimic or mirror the angles of the Earth, some of the mechanics of the Earth. And if those angles are not correct, I find that people are less likely to feel good. So that I've kind of created the system of what I believe are critical angles. And then the third type of alignment I call archetypal alignment. And this stems out of an area of academic study about how mythology was a mode of transmitting scientific information. So for example, in the Egyptian myth of Isis and Osiris are all of the numbers of the Earth's precessional cycle, how it rotates and tilts over time. And there are other major myths from other cultures that have the same numbers in them. And so beyond that, the easiest way to understand this is looking through the lens of Western astrology, or this is where most people will understand it. That the ventricles in your brain that make cerebral spinal fluid look very much like the ram's horns that represent Aries, and in astrology, Aries rules the head. The way your hyoid bone in your throat sits on top of your looks like the symbol for Taurus, and in astrology, Taurus rules the throat. Your aortic arch is the same shape as the symbol for Leo, and it works this way the entire way through the body, and it works across different mythologies too. This works in Egyptian mythology, this works in Hindu mythology, and even in other stories, there are biblical stories that tell the story of our anatomy as well. So this works in many, many different forms. And so to me, these are the, this is the, really the holy trinity of healing to me. And as a stress management expert, we know, medically, we know that stress is the root of all disease, but we don't really dig very deep into really what that original stress is. And that's where the mythology and looking at the way, I think it really tells us just literally how the cosmos is coded into us. And looking at ourselves at that level really helps get to those deeper layers and resolve that original stress to help people get better faster. All right, so now we're going to get to the good stuff. So your vagus nerve, this is the only image I've actually been able to find of it in its entirety. And this is obviously out of an older medical book drawing. I know there's a group of electrocardiologists that are mapping the vagus nerve right now because even this is not the entirety of it. We know we don't know all of it yet. So your vagus nerve is your 10th cranial nerve. And so that means it comes out of your brainstem. It's outside of your spinal cord. It exits the base of your skull. And it goes all the way down to your pelvis, as you can see. Vagus in Latin means wanderer. And so the easiest way to tell when your vagus nerve is not working optimally, basically when it's been dialed down, is when we get stressed and we get a lump in our throats and our palms sweat and our hearts race and we get constipation or diarrhea, because those are all vagus nerve mediated functions. So as your vagus nerve comes out of the base of your skull, it goes down and innervates the pacemaker cells of your heart. It loops underneath your aorta on the left and your subclavian artery on the right and goes back up to innervate your vocal cords and swallowing muscles. It's really involved in all of your senses. It travels down your esophagus through your diaphragm. It innervates the muscles of your digestive system. So it innervates the muscles that move the food through your digestive system. And it goes all the way down into the pelvic area. In women, it innervates the cervix and clitoris as well. Beyond that, you cannot absorb vitamin B12 without your vagus nerve. It also mediates inflammation, and so that's been a huge part of why it's been so important to me as a physical therapist, because I'm always seeing people in pain, so mediating inflammation is a huge part of what I do. How well your vagus nerve functions determines how long you will survive if you have pancreatic cancer. In the research, a lot of what they do is that they'll put an electrical stimulator on the vagus nerve. And they found with that, and this happens surgically too for sometimes for chronic pain issues as well as seizures, they'll implant a vagus nerve stimulator. But in the research, they found that vagus nerve stimulation heals the mitochondrial defects that go with ischemic heart disease, which is heart disease due to reduced blood flow. It also reverses insulin resistance in diabetics. It is associated, and beyond that, how well your vagus nerve functions is related to, has relationships with burnout, with suicide ideation, and women with complete spinal cord injuries can achieve orgasm with vagus nerve stimulation. So it certainly has a role in sexual function as well. And so there's just lots of amazing things that the vagus nerve does, and that's just kind of skimming the surface. But I have used it definitely for patients with anxiety, with depression, with all kinds of musculoskeletal pain. It just gives very beautiful systemic shifts. I find it shifts your neurological patterns, the way you recruit muscles, so that you start recruiting muscles in the proper way rather than substituting, or it helps you overcome your compensatory patterns. And I would liken it, for me, it's just been so much of a magic wand, and it's been so fun. So I help people, I teach these exercises a lot. I also treat people, help them get deeper decompression of their vagus nerves. And I am going to show you guys just some foundational things today. But there are additional techniques that I use to work with people both in person and online and in groups as well to take this work further. And so there are 6 major compression points that I address with this. And the compression points are really where you have horizontal structures, typically. So the base of your skull, your vocal cords are horizontally oriented. Research understands well that trauma and stress always affect our voice and our breath, and our vocal cords and diaphragm are horizontal muscles. So we've got the base of the skull, vocal cords, your thoracic inlet, which is basically the space between your collarbones and your ribs, where it can get pinched. Your respiratory, it can also get pinched at the level of your heart, usually on the backside, between your heart and your spine, at your respiratory diaphragm, and also at your pelvic floor. So there are some rules of engagement here. I'm going to take you through this big assessment. Take responsibility for your own body. None of this should hurt or make you feel worse. You might have some mild muscle soreness because you might start to use muscles that you haven't been using normally in a while. But overwhelmingly, you should feel better with these. If you're unable to get into the position of the exercise for any reason, whether that be pain or limited range of motion, you can adapt it as best that you can, or you can just imagine doing it. Your brain does not see actually doing something and imagining doing something as any different. So you can really use your imagination here if you have issues or can't get into a particular position. I anticipate that you will feel much better. You will get more range of motion. You will feel less stressed. And you might even, things that you didn't even consider might get better may improve too. I've had people with hallucinations have resolve with getting their vagus nerve decompressed. I've seen it resolve heart palpitations. I've seen it resolve pelvic floor incontinence issues too. So like there's lots of potential here as to what might happen. And if you have any apprehension, please consult with your medical team first. We're going to take you through a self-assessment, a set of positional breathing exercises, and then we'll quickly go through and kind of reassess and just see how things have changed. To assess yourself, the first thing you're going to do is just check how your head turns side to side and see if you're symmetrical or asymmetrical. Okay, if it's how it feels, when you get to the end, if it feels like a brick wall or if it feels soft and springy, it ideally should feel soft and springy. The next thing you're going to do is just look kind of down towards the floor, just about 45 or 50 degrees, and turn your head to the right and the left. And you should go about 45 degrees in each direction. And you shouldn't need to like bend your neck to the side or anything, just nice straight rotation. And that's checking the rotation between your first and second cervical vertebrae in your neck. The next one is to check your larynx. And so we're going to take a couple fingers and just put them on the front of your larynx or on your Adam's apple. Do not be touching the side where your pulses are. You want to be right on the front. And then as you turn your head right and left, you're just feeling, basically as you turn your head, your larynx should rotate with it. If when you turn your head, you feel like your larynx heads sideways, that's not normal. You should just have a nice aligned, your larynx should rotate with your neck. It shouldn't be shearing to the right or the left as you move. All right, next thing is to turn your head to one side. So I'm going to the left here. I'm going to bring my ear towards my shoulder, towards my chest. Okay, and I have a pretty normal amount of motion here. If you're hitting a brick wall way up high or getting pain, then that tells me that your first ribs, which are right up here, are elevated, and that can happen because your vagus nerve gets compressed at the base of your skull. The next thing is while you're sitting, and you can absolutely be in a chair. I very often have people, when I do this, with their feet on the floor, but I'm on my table here just for demonstration purposes. So you want to have your weight equally on your sit bones. Give yourself a hug and turn to the right, and then turn to the left. And it's normal to go about 60 degrees to either side. And when you turn, make sure you're not shifting your weight or leaning. These are easy things. We all take the path of least resistance when we move. But just very gently check your rotation to see how that feels. You can check your shoulder motion. Bring your arms up overhead to see how far you go. Ideally, you should have 180 degrees, be able to get your arms up next to your ears. If you're stuck out here in front of you, I'll turn sideways here, you should be able to go up like this, but even if you're limited up in here, there's room for improvement. You can also look at how your arm comes across your body. So you should have about 35 degrees, like if this is neutral, you should be able to come across about 35 degrees. And that means without bringing your shoulder blade with you. So your shoulder blade stays back on your rib cage, and you should be able to come across pretty nicely here. The other shoulder motion is to check your internal rotation. So you can Put your hands up like goalposts. So your arms are at 90 degrees, 90 here. And to rotate downward. And again, don't bring your shoulder blades over. If you get to where you're doing that, you're compensating and you don't have the range of motion past that point. So it's normal to have about 70 degrees. Like if that was 90, this would be about 70 in that position. The vagus nerve does not go into your legs, but because of the shared neurotransmitter with your muscles, you also can get better flexibility in your hips and your knees and your ankles and your feet. So you can absolutely, the way that I usually teach people to check it is lying down and feeling the bone on the front of your hip. Bring your knee up to your chest, and your pelvic bone should stay still. If your pelvic bone rotates backwards, if you're pressing your low back into the floor or into the mat, you're probably limited in your hip. On your side, putting your hand up here when you lift your leg, again, your pelvic bone should stay still until you start lifting a little bit higher. You should not be starting, if you're hiking your hip to start, that's not normal. You're using your little hip hiker muscles to lift your leg, and you're skipping over your big gluteal muscles that are supposed to be doing that. And that's a very common marker of a compressed vagus nerve. You can also check, again, feeling the bone, especially on the front, but you can see how far back you can go. And again, you shouldn't be arching your back, or your pelvic bone should not be dropping downward towards your foot as you bring your leg back. You should be able to keep it all even and come back like that. I have a lot of motion here, so this you'll be able to see this, but this is not everybody has. It's not necessarily normal to have this much motion for this. But when you straighten out your knee, in the last 30 degrees or so, your tibia rotates to the outside. And so some people do not have any tibial rotation. I'll say it's very common for people with back pain and knee pain to not have the proper rotation there. And I will tell you from personal and professional experience that sometimes the rotation even ends up being the opposite direction with people in pain. I have had that experience with my knee more than once. And so as you straighten out right at the end, your tibia, the lower leg, should rotate outward, and that should be independent of your hip. It shouldn't be coming from your hip joint. You can also just kind of check your ankles to see how flexible, just to get a sense of the flexibility with your ankles, and you can check with your knees bent as well as your knees straight, just to see how it feels. And you can also even extend your big toes. And this is ideally done on the floor, but basically when you bring your big toe up, you shouldn't feel like the ball of your big toe gets driven into the ground. It should all feel nice and level. If you feel like you're adding a lot of extra pressure on the ball of your big toe when you lift your big toe up, that may indicate that your vagus nerve is compressed too. And to me, that is a telltale sign that your vagus nerve is compressed at the base of your skull, particularly if you do not have any toe injury or foot pathology going on. So that's the assessment. And so I'm going to take you through how to treat that. The first, so with all of these exercises, we're going to do the same breath pattern. You're going to inhale for a count of 5, hold for a count of 8, and exhale like you're blowing up a balloon or through a straw for a count of 13 or as long as you can. If you can't do it that long, you can do a 3, 5, 8 breath, where you inhale for 3, hold for 5, and exhale for 8. If you do nothing else, exhale as long as you can. That makes the biggest difference. I choose this pattern because these numbers are in a Fibonacci sequence, which is the math of nature. It's how flower petals are arranged. It's how our ears and our faces are shaped. It's the ratio of our bones throughout our bodies. And so this is it's just the math of nature, and that's why I teach the breath in that particular pattern. Okay? So we're going to start at the pelvis and work up to the head. And so for this first exercise, you can do it in standing or lying down, but you want to put your hands on the outside of your pelvic bones, just like you don't want to be right at the top. You want to be like an inch or two, couple centimeters down from the top of your pelvis. And it's helpful here to imagine that you have flashlights or laser beams in the palms of your hands. So as you have your hands here, you're going to imagine that you're connecting the flashlight or laser beams between your palms. This isn't about, you don't need to push hard. It's just about having a deeper connection with your tissue. So what happens is that the pelvic floor sometimes gets stuck low. And so what you're going to do, and we're going to do the breath sequence, but on the exhale, with the nice energy connection between your hands, you're going to gently pulse up towards your head. Okay, so we're going to inhale for a count of 5, hold for a count of 8, and then exhale and pulse, pulse. And I'm going to do that 2 more times. When you do these, 3 repetitions should give you some amount of change. If you have a really specific problem, like a full dose of this would be to do 3 to 5 sets of 3 to 5 breaths. But you can do these often give you big changes with just a few repetitions. So you can assess your own body and kind of see how that goes. The next one we're going to do is for the respiratory diaphragm. And so the diaphragm, when it gets dysfunctional, goes from being a dome to getting flat. And in all humans, the right side of the diaphragm has more muscle mass than the left. So theoretically, the right side will always win. And so this is just a way to get the diaphragm to dome itself back up, but it also, on a bigger scale, when we're stuck like this, and the Earth below us and the solar system above us are both rotating the opposite direction, I think we're out of alignment on a much bigger scale. And certainly people that aren't getting better are out of alignment with whatever they've tried, are out of alignment on a much bigger scale very often. So to resolve that diaphragm dysfunction, you're going to take your left ankle and cross it in front of your right one. And just very gently press your ankles together. You're going to take your right hand and put it on the outside of your left thigh, or as close to that as you can get. And you're going to take your left hand and put it behind your head. Now, if you can't get your hand behind your head, just rest it at your side or get it comfortably, whatever works for you. It doesn't have to be exactly in this position. So you're kind of have you spiraled up here, okay? And then we're going to do that same breath where you inhale for a count of 5, hold for a count of 8, and then exhale for a count of 13. Two more times. And last one, inhale for 5, hold for 8, and exhale. Now, when the left side of the diaphragm is a problem, it's often because the right side has taken over. But sometimes, particularly if you have a hiatal hernia or reflux, it's really helpful to treat the left side. And so this is another example of when imagining those flashlights or laser beams in your palms is really helpful. So if you want your palms just on the left side of your lower ribs, like if this is where the notch between my ribs is, where they meet in the middle, and so I'm just on the left side of that, okay, and I'm not pressing hard at all, but what I'm trying to do is to rotate the ribs to the outside. So I'm going to exaggerate so you can see it, okay, but if I'm really doing it, it's not looking like very much movement. You're not pushing with more than a pound or half a kilogram of force. And so with your ribs kind of rotated to the outside, like a very gentle force there. If you're working to do this, you're pushing way too hard. Then do the same breath where you inhale for 5, hold for 8, and exhale for 13. Two more times. Okay. So next is to decompress the vagus nerve at the back side of the heart. And to do that, you're going to take your right arm and put it on your left shoulder. And I'll just pause here for a second to say that particularly these are not typically, this and the last exercise, you do not repeat the opposite way, because it's working on our inherent asymmetries that we have in our bodies. So your heart's a little bit off to the left, your right diaphragm has more muscle mass, so you don't typically switch it. Okay, so for the heart, right hand on left shoulder, left hand comfortably in the small of your back, if you can get it there. If you can't get it there, just rest it at your side or get as far as you comfortably can towards it. And you don't have to have your palm against your back, have the back of your hand so it's comfortably there. And this time when you inhale for the count of 5, you're going to inhale into the back side of your heart. Okay, so you're going to expand your ribs on the back side of your heart, and then hold for 8, and then exhale for 13. And I'll just say as a little bonus thing, you could also pause at the end of your exhale for a couple of seconds. There's research that shows that that also improves vagus nerve function. So 2 more repetitions, inhaling into the back side of your heart, holding for 8, and exhaling for 13. All right, I'm going to grab my water here for a sec. So for the larynx technique, it's helpful to have a straw. There, I went and spilled all my water. And I have a regular straw here, but it's helpful to have a coffee straw would work better, like a little teeny thin straw would be better for this. So if when you turned your head, you felt like your larynx started to slide to one side or the other versus rotate with your neck, you can just turn your head to where that deviation starts, where the sideways movement starts, and then do the same breath where you inhale for a count of 5, hold for a count of 8, and then exhale through the straw. If you don't have a straw, you can just purse your lips a little extra to add more resistance to the air. And so 3 repetitions of that. You can also hum on the exhale. And I have a whole series of structure for how I apply sound for this. But you can inhale for a count of 5, hold for a count of 8, and even hum into the straw. All right, and 1 more repetition. And I think that'll make 3 for this. So inhale, hold, and really purse your lips and exhale. Use a coffee straw. The last one here is an ear pull. And what you want to do, I'll come closer, you're going to grab onto what's called the tragus of your ear. And it's the tab that if you didn't want to hear me, you go la 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 and press down against your ear canal. You're going to grab the tragus of each ear between your thumb and forefinger. With your thumb on the front is usually the easy way to do it. And you're not going to, it's helpful, you can imagine that laser beam kind of coming out between your thumb and forefinger on each side. You're going to pull the right side to the right and the left side to the left. So it's a little bit like you're unwrapping a piece of taffy. You're just pulling straight sideways. And then that same breath as you do it. Inhale for 5. Hold for a count of 8. And exhale for a count of 13. And 2 more times. All right, and I'm realizing as I went through all of that there's one that we skipped over, the thoracic inlet technique. And so for that one, you have a notch right here at the top of your sternum, the top of your breastbone. Okay, so it's right between where your collarbones come into the middle here. And so you want to take your index fingers and gently put them in the notch right here. You're not giving any backwards pressure into the soft tissue. You are only on the bone here. Okay? And so the pressure here is somewhat backwards, but you're not sliding off the shelf of the sternum. You're just staying right here very superficially more towards the front of the bone. And you only have to press back with a few grams of force. A lot of the techniques I was formerly trained in are with 5 grams of force, which is the weight of a nickel. And this, when you're on these very gentle areas, you really do not have to impart very much force. So with your fingers on the notch, a very gentle force backwards, but not into the soft tissue that's behind the bone at all. Same breath pattern. Inhale for a count of 5. Hold for a count of 8. And exhale. And 2 more times. And as you do those, I'll say some of these, if you have a knowledge of acupuncture points at all, I have found that there's some correlation between the way I designed these techniques and acupuncture points, though I didn't know that in advance. And so I know that there's, I think that that's a little bit of, especially why this one at the sternal notch and the one at your ears why they work quite well. And so then when you're finished with those, then you go with this one, then you can go through and reassess and see how your neck motion is side to side. Look down towards the floor and see how you're 45 degrees to each side. That loosened up. I loosened up considerably there. You can recheck your larynx rotation with your neck. And recheck your first rib by turning your head to the side and bringing your ear to your chest. You can recheck your shoulder motion up above your head, coming across your body, and coming, rotating down this way. You can check your trunk rotation, right and left. And remember to keep your weight even on your sit bones. You can check how your hips are flexing up. Check your lifting to the side and the going backwards. If you had an issue with arching your back for this one, it should be better. That's one of these techniques do very well with that. You can check your tibial rotation. Your knee. Check your ankles just to get a sense of that flexibility. And you can extend your big toes too and see if that feels different as well. And I would love to hear from any of you about how this helped, or any questions or anything like that. But those are the foundational exercises that I teach people to really free up their vagus nerve and that whole horizontal system. And what it tends to do when we get injured, the first thing we give up is rotation. So like nobody feels great and has really great arm swing or feels terrible and has really great arm swing when they walk. When you feel terrible, you lock up rotation. And so as you walk, you should feel lighter and freer, and this really opens up that rotational system.
Mm. Melanie, I have to congratulate you for such an amazing, I did say amazing at the beginning, and I don't usually use that word, but I must have been predicting something. And because of the women that I treat, I know that those exercises are going to be life-changing for them. That is going to unlock the rotation. And I knew that as a therapist because I have lots of hands-on, but there's been a recent research and investigating the actual rotation of the spine or of the posture. Mm-hmm. And people kind of thought that happened with mastectomy, that there was a bit of bracing, but then they found it after implants or after breast reconstruction as well. So this is going to be a fantastic add-in to people that have had breast surgery.
Oh, well, I'm so excited, and I really want to. I don't get to treat that many post-mastectomy patients, but I'm so happy to share this. This works so well from my experience in a wide variety of populations, and it really just, like I said, it's so often so much like a magic wand, and I think we often make healing a lot harder than it has to be. And I think finding some easier pathways to that is really important.
So I'm just going to add in. So if I feel like selling this on your behalf, Melanie. It's like, so I'm talking about posture, and people do know that. Like they come in, they go, I just feel deranged. I feel like this is not my body. So I'll use the word deranged. But people also have gut problems and ongoing gut problems, and they may have had gut problems before the cancer. So this vagus nerve stimulation does have a big impact on the gut. We know that from the research. And so, you know, if we thought about that, Melanie, that people do have underlying scar tissue, so it's going to be causing this ongoing torsion, would you be thinking that people practice this like once a day, once a week? What would you be thinking?
I think if you have a more acute issue, doing it daily, or an issue that you're actively dealing with, I absolutely think doing it daily is most helpful. And I tell people that if, it's more important for me that people do it than sort of how they spread it out or, cluster it. So like if you're the type of person that you want to do 5 sets of 5 breaths and get it all done in the morning, for example, then go for it if that works for you. If you're somebody who would rather do 3 to 5 breaths every time you go to the bathroom, or every time, you walk into a certain room in your house or something, whatever like that cue might be for you, or a few at the top of every hour or every couple hours, then that's fine too. I think it's totally fine to spread them out throughout the day. And I don't have anybody do usually every single exercise. Usually there's a couple that are the most needed. And so you can absolutely play with this and see which ones give you the biggest change. Mm-hmm. They're great. If I was going to pick 2 for you, like I would say the diaphragm one that was like this and the ear pull. they're great when you, like, if you zigged when you should have zagged, or like you helped a friend move furniture and that's not something you normally do, and you think, oh, I'm going to pay for this later. Those two are really nice at kind of resetting that. If I was going to throw a third one in, I would say the breathing into the backside of the heart. Like those three will, I would say, I teach most often, or I see stuff the most, and they yield very wide benefits.
Nice.
Like I said, it's like I will treat the base of the skull for somebody with an ankle or a foot issue, and they will get dramatic shifts in their ankle biomechanics and foot biomechanics without me even having to touch their foot. And so
Melanie,
it's really fun like that.
That is just brilliant. I have been dealing with a foot injury myself, and I cannot believe the difference in my big toe isolated movement just from all that set of exercises. What that would take really, maximum 10 minutes, maximum.
Oh yeah, no, I think it's so easy. And I think if you're in a pretty good place, you could do these once a week and be fine, and just to sort of have them in your toolbox that, if something starts to get a little achy, because very often by the time I see somebody, for example, that's had back pain, the story often goes like, oh, I had a twinge here and I was feeling kind of tight or whatever. And then were a couple other small incidences, and then there was a big episode that made it much worse. And when you have those little, take those little moments of your body talking to you and go, oh, I need some attention, like I need to get my rotational alignment back, that I find that that's very, these exercises are very powerful. And I think, and they're so simple in the big picture. And really, if you can't remember the positions, you're somewhere and you're not in this video, and just exhale as long as you can. So much happens because we get stuck like in a gasp. And a lot of restrictions, even into your hips, have to do with not having your diaphragm mechanics and your airflow mechanics in your lungs correct. So even if you're just doing a really long exhale, that can be super helpful at loosening up even your hips.
Nice. So Melanie, I'm just going to put it out there that this is experimental for breast cancer. Really, there is no research on this method.
Right. And I'm actually looking for partners to research this process, because I have found it works so well, so long, and in so many different populations, that I'm really trying to get some more structured data around it as well.
So I guess that's tick one. We're looking for collaborators for you, Melanie.
Absolutely.
So then I'm thinking, so we can look after you, the people that are listening. I'm hoping that we can help you, Melanie, by sharing this amazing information. And then for people that, some people can just pick up stuff and just run with it, and but there are other people that just are worried that they might be doing the wrong thing. But you mentioned online services. Would that be something that you could offer?
Absolutely. I work with people online all over the world, and I help guide them through this process and more, and really dig deeper into what that stress, their underlying stress actually is, and to clear it so that then it's not an obstacle for your life in terms of your health and wellness and relationships and all sorts of different things. I think like I said, I think we often think way too small about alignment.
Lovely. Now, just to double check, Melanie, you're you're in America. Which state and which town?
I'm in New Orleans, Louisiana.
So people that are nearby would be, lucky to come and visit you. People that are way further apart can either choose to have a go and see if it works for them, and if they feel like they need more guidance, they can connect with you, and I'll have your website details on the at the site where we're viewing right now.
Oh, I would say also, if there's interest in having me come present a workshop or do some kind of group event, I am very open to traveling, and I teach workshops around this here locally, and so I have a show that goes on the road. So
nice. So that we can, we're just going to make it easy for people. There'll be the website connection, and they can contact you via that website. It was such a pleasure, Melanie. And I do have to say, for those people that have lasted right to the end of this video, then, like the summit is, I just think, gifted with some amazing energy. And so I put it out on the LinkedIn and just said, who's doing vagus nerve stuff? And a couple of people mentioned Melanie. And so that's how we connected. And so I just think that, Melanie's talking about the earth energy and the cosmos energy. There's also a LinkedIn energy. And I want to thank LinkedIn for connecting us, Melanie.
Oh, absolutely. This is fantastic. And this is very special to me too, because this is the first time I've really shared this whole, I'm really happy. I really want this to be kind of a public health thing, and just to put it out there, and to really help impact get as many people lined up in a bigger scale as possible. So I appreciate this. I was so happy to have the invitation to put it out onto this kind of platform and to be able to get out to a large group of people.
Thanks, Melanie.